Are you exaggerating that or no?
I don't think so.
Calm. There we go. Okay.
I'm scared I'm gonna hit the camera with my foot.
Or the mic. Yeah, that's a good point. Are you able to pull this further yourself?
I haven't warmed up today.
Haven't warmed up today. Jesus, that's the second dancer in a row that's been able to do that. Okay, let's see. All right. Damn. Whew. Meg, good to see you again today.
Yes.
Meg is a dancer and student and all-around creative who's in today for various kind of complaints. I'm going to let her talk about them though. So Meg, why don't you kind of share what you're in for?
So I find that I go from like, it's either like 0 to 100. I'll go for like sitting, not moving for like hours on end, and then doing like insane exercises and dancing and stuff, which definitely like kind of my body's like, okay. I do like do a good amount of warm-ups and then like stretching afterwards too. But yeah, I find that I'm always able to at least like back and hips crack and pop them. So I guess yeah, maybe just release some tension. And my shoulders also, like, especially where my traps are, they hold a lot of tension, especially when I like look like this and
Look
I'm on my
down
computer
kind of
all day.
Yeah, okay.
Yeah. Especially it's like going from like this all day and then like doing like a full range of motion and like moving my neck around and throwing it around when I dance. Yeah.
So you're really, it sounds to me like Meg is in the two kind of extremes of patient activity levels right now. Obviously, you're a student, you're in your undergrad, you're going to be studying for a good, well, hopefully studying for, right, for a good majority of your day. But then to go from that to competitive dance level, like high range of motion, it could be almost a little shocking or alarming without kind of like that build up and necessary kind of like prehab or warm up work, right? You commented that it's really your hips that feel like the tightest as compared to the rest of everything, but also you got that usual shoulder kind of tightness that a lot of students face too. Do you get any headaches at all, or are you still spared those?
I don't get headaches, thank goodness.
That's lucky.
But yeah, I'd also say I think I don't know if how I sleep matters too, but a lot of the time, like neck and shoulders, and then I end up feeling it in my lower back too, how I sleep.
Yeah.
So
are you just like all over the bed? Like
I'm a side sleeper.
Okay. Yeah. All right.
And then sometimes I'll lift one leg up to try to even it out, but then my head's
all
weird.
Over the bed. Yeah. Okay.
So,
okay.
Yeah.
So I mean, sleep position. The best sleeping position anybody can adopt is whatever they're able to actually get restful sleep. And so if sleeping on your side is the only position where you're able to wake up and feel refreshed, sans all the like neck stiffness and whatnot you're dealing with, then that's the position you're going to go. Except I say don't sleep on your front. Sleeping on your front is a recipe for really, really aggravating the neck. Yeah,
I sleep on my stomach sometimes.
There we go. I appreciate the honesty on that. Okay, so hip, low back, shoulders, upper back type region. We'll get into the physical exam today, unless there's any other complaints that you want to mention before we get into that, or is that basically sums it up? Okay, so we'll get into the physical exam. We'll check out your ranges of motion of all the mentioned areas, and we'll see what we can do for you. Okay? All right, so as per usual, we're going to be starting off with the range of motion assessment. I'm going to get you to face forward for me and bring your chin down to your chest for me. Any discomfort or pulling in either the shoulders, the neck, or the upper back region?
No.
No? Now what if I go ahead and actually push you further? Still okay?
Yeah.
Good. Come back up. Look towards the ceiling, please. Any discomfort kind of in the neck, shoulder region with that? No? Going to pull you a little bit further. Still okay?
Yep.
Yep, she said, sounding not very okay. I'll get you to rotate your head as far as you can to the right. We can get to about 75 degrees as far as you can to the left, please. We can get to 80 degrees. A teeny bit further on the left side as compared to the right, but it's not that great of an asymmetry. I'll get you to bring your right ear down to your right shoulder, please. Good, we're keeping that shoulder low. I like that. We can get to pretty significantly to maybe about 55, 60 degrees, and now left to left. Oh, 55, 60 degrees. Okay, good, good. Give yourself a tight hug. You probably earned it. Tight, tight hug. And rotate as far as you can to the right, please. We can get to 45, 50. Now as far as you can to the left. We can get to a little bit decreased on this side, maybe like a 35, 40 on this side. So a little bit of a decrease, rotating to the, was that right or left that we just, that was right, perfect. Yeah, a little bit of decrease on the right as compared to the left. There we are. Go ahead. I want you to drop this right here. Just let me hold the arm, dead arm. There we go. That's what we're looking for. Still, still, still. Missed. There we go. Turn over. And hold right there. Those are big ones. Nice. Turn over. You okay there? Shocking, eh? And drop the arm, drop. Normal upper limb neuro. Are you exaggerating that or no?
I don't think so.
Okay, relax, nice and calm. Okay, that's more real. Nice and calm. There we go. We got some big hyperreflexia on Meg. Now, hyperreflexia, believe it or not, maybe I should get a little bit lower so y'all can see my face here. Hyperreflexia can actually be a bad thing in some cases, but if we're seeing it symmetrically, I'm not super concerned about it, especially in an otherwise healthy population that isn't showing any other neurological signs. So, hyperreflexive, but that's just something to make a note of. Let's go back here. All right, bring me these legs. You weren't expecting that, were you?
What? Yeah.
Relax that. Good. And relax this. Good. That's fine. And that's fine. So, for example, let's come forward again. For example, that final test of scraping the bottom of the feet, also known as Babinski's, if that was positive, that will be concerning in combination with the hyperreflexia, but it's negative in this case, so I'm really not concerned. All right, so Meg was commenting that she gets a lot of tightness kind of within her lower back and hips primarily, but also gets it up into the shoulders too. So we're going to be kind of feeling through all of that today and also be doing a range of motion for the hips proper. So starting down here. Now, do you have one side that feels particularly more stiff than the other usually? Or no, you're pretty symmetrical? Because to me that feels pretty symmetrical right now. It is a little bit tight, but it's not like one side is noticeably worse than the other. Got patients being loud in the lobby over there, but that's okay. Alright, so we're going to start off with our straight leg raise test here. We're just going to bring this all the way up. And do we get any kind of stiffness in the low back, or are we limited to hamstring only?
Hamstring.
Are you able to pull this further yourself?
I haven't warmed up today.
Haven't warmed up today. Jesus, that's the second dancer in a row that's been able to do that. Okay. Awesome. So no tightness there, and we're able to do that on both sides, kind of symmetrical?
Well, not as flexible.
Not as flexible? Okay, so there is a side that's tighter then.
Yeah.
Okay, so you're not as flexible on the right side. And okay, we are starting to get some shakiness. I don't know if we can see that on the camera. That's a sign of the muscle either fatiguing out or just really being intolerant to that movement. So we're going to do next is bends the knee. Bring this over. I'm going to place this behind your hip and push on through. Any discomfort with that? No? Awesome. Okay. Same deal. We're going to bring this up, place this behind the hip. And any discomfort with that? No? Good. All right, hip range of motion. So obviously we got quite a bit of hip flexion on this side if we're able to get it all the way up to basically the head. But if we can rotate like that, do we get any pinching in there? No? That's okay for you? All right. There might be a pop with this one. Yep. Yeah. How did I know? I wish the mic was on that side. That's okay. Get you to relax that. But so that happens to you commonly then in external rotation?
Yeah.
Okay.
Like I'll normally just do that myself before I start dancing because I know it's going to happen, so just pop my hip.
Mm-hmm. And let's... So there's a lot less internal rotation on this side as compared to the other side.
Yeah.
Any ideas as to why that might be?
I've just always been a lefty.
You've always been a lefty, but you're stiffer on the right. Do you get any kind of knee discomforts or pain on this side?
No.
No? Okay, that's lucky for now. And we'll go ahead, bend this, and let's see. That's a real. Yeah, okay, that's a real right there. All right. Damn. All right, so
that's just like common.
That's commonplace for you. I'm happy that it is because it's not commonplace for other people. All right, we will get you face down next. Once again, coming through. Are you left-handed as well then? Or
No.
No, you are right-handed. Okay.
Do you like my huge traps?
Massive.
I know,
Absolutely.
I do have really big traps.
This woman is swole, everyone. Alright, so what I would want to do now, okay, because you're in the position, is I'd want to adjust kind of in through the middle back here. Okay? So you haven't seen a chiropractor before, have you?
No.
No, alright. So the adjusting is going to be very similar to what happened in your hip there. Okay, there's going to be a sound very likely. But what I need from you to do is, or excuse me, what I need you to do while we do this is to take a big breath in for me. Then a big breath all the way out and sink into the table. All the way out. Good stuff. You okay?
Yeah,
Love it. Good. All right, and one more. It's going to be in and out.
Okay.
Okay, so in and all the way out. Sink. There we go. Good stuff. That wasn't too scary, was it?
No.
Good. Happy to hear. All right, let's stretch out the low back before we go for it. She's already in a very good position. I'm going to get you to actually bring this bottom leg straight. Bottom leg straight. Top one's going to come up. Good. I'm going to scoot your hips towards the edge here, please. Thank you. And from here, I'm just going to rearrange the arm. You're going to go right there and just lightly grip. Nice. Now for this position, once again, actually, I'm just going to roll you towards me. Ooh, that was a really loud one. Eh? I think there might be one more in there. I'm just going to check real quick. Nope. Okay, we got them all on the first go. All right, let's get you on the other side. Go ahead, we're going to uncrowd this shoulder, okay? Good, and you hold just like so. Bottom leg straight, top one bent. Scooch the hips towards me, please. Thank you. And breath in. All the way out, all the way out. Good, good, good. Whew. That one went really well, too. Good job.
Yeah.
Meg, are you comfortable if we actually just roll this down to here? Is that okay? All right, I'll let you do that. Right good. There, that's perfect. Yeah, you good?
Yeah.
Awesome. All right, and you just go face down. Okay, now we'll start. So, all right. So as per normal, we're going to be starting, or not starting, but including some instrument-assisted soft tissue therapy in this treatment. I love the fascial component of treatments because very few practitioners actually address it thoroughly. So we've been able to get a lot of patients feeling less stiff than they have been at various other chiropractors, physiotherapists, massage therapists, etc. Don't ignore the fascia. If you're a practitioner watching this stuff, your patients will love you for it. Now, at this point in time of the video, I also usually like to ask my patients something about themselves. So what I want to ask Meg here today is for something about herself that she's proud of, something that she'd want to share with people but doesn't get to do very often because it kind of sounds like she's bragging. But still, I would like to hear. So Meg, is there anything that you're proud of yourself?
So, as you know, I dance.
Yes.
But recently I was able to choreograph a group piece from a university.
That's super exciting.
That was really cool and awesome experience. And choreographing is my favorite thing. I love to dance, but being able to actually choreograph I love it. It's so fun.
So how did you find yourself in that position? They were looking for choreographers, or?
Yeah. So I've choreographed before for other things like in high school. So they were looking for choreographers and I just auditioned and applied and they were like yes, and yeah, it was super good. I did it to Girls on Film, which I love, by Duran Duran.
Okay.
And it was so fun. It was jazz funky, so it was awesome. And everyone in the dance is so talented, so they made it very, very easy.
I was going to ask if there was any element of it that you found particularly challenging.
I find formations and spacing hard sometimes, because that's the math part of it.
Math?
Yeah.
Ugh, gross.
I'm not good with math, so...
Hey, neither.
So, yeah, I'd say that part, but they made it so easy, because there's really good dancers.
Good.
So, yeah.
Well, that's awesome. And not only are you good at the sport itself, but now you're also essentially teaching or helping guide others through getting better at it too. So that's pretty rewarding, I would say.
No, I love teaching.
Just accidentally nudge the mic. I'll move that back a little bit. There we go. Is a teacher in you, eh? Is that what you want to do once you're finished at university, or?
I don't think I'd teach in like academia per se. I'd love to teach dance as like just a side thing.
Fair.
Or like more so hobby.
Mm-hmm.
But yeah, no, I always want to dance, even when I'm really old. So.
Good. So the primary muscles that we use to stabilize in through the hip, or to also open up the hip, is going to be the hip abductors, the outside aspects, the hip adductors, the inside aspects, and then the glutes themselves. So we're going to work to loosen up all of those. We're going to start with the glutes because Meg is already face down. The way we like to do that, or the way that I like to do that, is we're going to take that leg, we're going to bend at the, I almost called it the elbow, at the knee here, and we're going to go ahead. You can use either a thumb contact or an elbow contact. You know, if you've been on this channel before, I really do like the elbow contacts. And what we're looking for is we're going to be trying to hit two structures here, okay? The first one's going to be the piriformis muscle, which I'll throw a diagram up probably right around here, this region of the piriformis there, as well as the glute medius, which we're going to switch the diagram to now. Glute medius, there we are. So piriformis, it's going to connect from the sacrum out into the greater trochanter. So taking a contact in that region with the elbow, I'm going to take that contact, and then we're going to rotate the hip by moving the leg as a lever. Is that okay there, Meg? Is that tender at all? Are you okay?
I'm good.
Good, happy to hear. So sometimes this can be quite painful in individuals, other times they're able to bear it pretty well. So Meg, we just finished talking about off camera about how tough and strong she is, so that's I'm not surprised to hear that this isn't too bad for her.
Yeah, it gets more tender the more outside you go.
The further lateral, so out from that angle. Okay. So that is working into the adductors. We will be working them after we finish with the piriformis on both sides for certain. All right, let's do the other side. Oof, muscle twitch there. Better or worse on this side? This is the more mobile side, isn't it?
Yeah.
Yeah, okay. So now we're going to be working in that glute med proper as well as some of the adductor muscles here. So what we're going to do is we're going to take a contact once again with that people's elbow. And once I do that, Meg, I'm going to get you to bring your leg forward, like up towards your chest. Good. And then drop it off the table like so. And that's a little bit more tender than the piriformis was, wasn't it? Okay. So this might be more the necessary target area. Let's go ahead and do that 7 more times because 8 is a fun number.
7?
Yeah, well, you can do it. Aren't you tough and strong, or were you just lying
so
about that?
tough and strong.
Oh, there you go. Yeah.
Okay, 4 more.
Is that 4 already?
No,
you wanna
3.
add
This is 4.
There
No.
All higher, 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 and then good. All right, back up. Again. 7, and remember how I said that I'm bad at math?
8.
Last one. One more. Bring the knee up a little higher. Bring the knee up to here. And bend, bend, bend. There we go. That is definitely more. That needs work. Okay, that needs active work. I'm literally telling you right now. We're going to do that on the other side, okay? Going to go ahead, take the contact in there now, and bring that leg up. Bring the knee up, 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 and lower down. Better or worse or the same on this side? I'm going to guess worse because you immediately ran back without holding it at range whatsoever. So bring up, 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 up. Bring the knee higher, higher, higher. Lower down and hold it, hold it, hold it.
It's that part.
It's that part. Yeah, no, that's the part that needs it the most. Okay, you can't just be working around that. And once again, bring it up, 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 up. Lower, hold, 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 hold. Good. Here, you know what? Let me help you. Okay, how about that? We're going to come up, 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 up. Good. Right, now I think that was 1. That was the first rep, right? So we do 7 more?
No,
my
we're
bad.
doing like 3 more.
3 more, got it. Mm-hmm. Sorry about that, Doc. Yeah. Good. 2 more. And last one, last one. Good stuff. Phenomenal.
Yeah, I can feel right there where you did the other thing.
Right down here? That's the spot, eh?
Yeah.
So we are actually looking into the insertional areas of basically all the glutes in that region. So definitely, I think you could really benefit from either more elbows within the hip stabilizers or seeing a massage therapist for the region. Truthfully, you as a dancer and as a choreographer, you're using these every single day to a very extreme extent. So I do think having some kind of manual therapist in your corner will be very beneficial to your performance and overall maintaining your health. You won't have the benefit of youth on you forever, unfortunately, taken from the guy who's about to run out of youth. So definitely something to consider going forward for yourself, okay? Meg, how did you find all of that today?
Very nice and great. I feel very loosey and goosey. It felt very good. The scraping was really nice, and honestly, the cracking it was really good. Like not as like insane as you think. Like literally did not hurt at all.
You were concerned about that coming in, eh?
Yeah,
like you were afraid that it would hurt a little bit.
It felt so good, and it was so easy, like easy peasy. The only thing was I feel like the thing at the end,
which one?
The elbow.
Yeah, the glutes, right?
It still felt good, but again, that's something where it's more challenging. Where it's like absolutely. It needs to hurt for it to feel good, which I get. So yeah, but overall, very good, very comfortable. Yeah.
Happy you're comfortable. Like I said earlier, you are a competitive dancer and you're at a very, very high level to the point of teaching other competitive dancers or choreographing them. You would really benefit from having somebody to work in through those glutes to try to relax them. Naturally, when I do MRT, which is the name of that technique that I did, it usually is quite sore, okay, but not that sore, not on like in that case we would consider that as symptomatic work there. So I'd really consider seeing either myself or physio or a massage therapist, even osteopath, someone who focuses on soft tissue work to try to release those every now and again, okay? But I'm happy everything else felt good. I'm really happy. First chiro experience. I don't think I've turned you off to the profession entirely. No. Do you have any questions for me? Any concerns, comments? That's not. You don't have to ask me something. I want to make sure I give you the floor.
Like similar to elbow, could I just take like a foam ball and like roll on the foam ball?
Yeah, you absolutely could. Now the one difference there though is that when you do have somebody who understands the anatomy behind the glutes and indeed any muscle when it comes to doing MRT, the way that MRT functions is by taking a muscle from a contracted or a shortened position, pinning it, and then bringing it through to a longer position, okay? When you are rolling yourself on a foam ball, very often you're limited in the range of motion that you actually have access to, because how else do you keep contact with the ball the entire time, okay? Here, like, you don't notice this because you're too busy being in pain, but as you are moving around, I am moving my body with you, ensuring that the pin stays in the right location, and that's just not possible if you're the only one doing it, right? That being said, if you are self-managing, yeah, absolutely, that's something you can do to try to release that area yourself. Will it be as effective? I can't imagine that it would be. Yeah. Any other questions? No? All right. Well, if that's the case, thanks for coming in. Are you a handshake or a high five kind of person?
High five into this.
High five. Okay, that's. I don't know if I'm coordinated enough. That would be. Try. It's the. There we go. We'll cut.
And don't forget to like, comment, subscribe, and put on post notifications.
Oh, thanks, Meg. I filmed that for bloopers.